Hi, my name is Dr. Mirrafati from Mira Aesthetic Cosmetic Surgery Center. I've been asked by several of our patients to do a video describing the different types of peptides. Seems to be there's a massive amount of confusion about the different peptides there are. So peptides basically means a small chain of protein. That's all it is. It's just a small chain of amino acid that attaches to the outside of the cell and signals the cells to do whatever it intended to do. That's all the peptide is. And right now, because of the popularity in losing weight, there are different peptides that does basically the same thing, but the makeup of it or the amino acid chain of the peptides are a little different. Hence, the action of it is somewhat different. So I'm going to do a series of video. I know I don't want to make this horrendously long, but generally there are three peptides. And again, peptide are a small chain of amino acid that signals the cell to do certain things. So the first peptide that started is semaglutide or GLP-1. Now, this peptide was particularly developed for diabetes type 2, and the byproduct of it, people find out that they're losing weight, so they try to also say, oh, not only it lowers your blood sugar, but it also you lose weight. And they found out that through the glycogen storage, which I get into later, that's how you lose weight, because it also feeds your hunger, that is, you're not hungry to take the sweets that you don't need to have. So the semaglutide GLP-1 was the first peptide that was developed and was marketed to trade name Ozempic, and the different companies are doing a different trade name of it. But basically is GLP-1 or semaglutide. Then from there on, the other companies got on the bandwagon, started to produce other peptides that are a combination of GLP-1 and GIP, which is tirzepatide, which I get into. But basically what all these peptides do, basically what it does, it fills up your glycogen storage. Glycogen storage is the storage you have in your body, telling your body that you're basically your full tank. Sort of if you're, if the gauge in your car shows that your unleaded is full, then you won't go to the gas station to put more gas in. So the same scenario, it shows that the glycogen storage is full, therefore you're not hungry. And the idea of it is to walk away from the sugar, which it's the worst thing you can have, to walk away easily. It's a lot of time people come back and say, hey, you know, I haven't lost that much weight, but I can easily walk away from the sugar. So it's doing what it's supposed to do. But it takes some time. So some fats or some people's body fat are very condensed. So it takes a little bit of time for you to start breaking down fat. Some people's bodies are not as condensed, and then you actually react to it much faster. So in a nutshell, GLP-1 or the semaglutide that you take, it's a small chain of amino acid peptide that affects your hunger level by telling your body, hey, my glycogen storage is full. I don't need to take these sugars that I no longer need to have. And therefore, you start losing weight. Now, it is very good because it decreases the spike in your sugar, which is the worst thing you can have. Sugar spike is what you don't want. So in essence, we all have the same amount of insulin that's produced, but as we grow older, the insulin resistant or insulin sensitivity goes down, insulin resistant goes higher. And what this semaglutide does, or this peptide do, they basically increases the sensitivity. So the same insulin that you have, it's become more reactive, and you start putting sugar into that storage, and you don't have it just running around doing what is not supposed to do and damaging your body. So The milligram of semaglutide or GLP-1, they start with 0.25 and then it goes to 0.5 and 1 milligram. Now here in Mira Aesthetic, we always start at 0.25 and then after about a month and then we get your body. The first week is 0.25, then we get you to 0.5 and we keep you at 0.5. Our labs that we buy the stuff is 99.9 pure, and we basically can show you the purity done by a third party. Now that's very important. When you go buy these things, you might want to ask, hey, can I see the proof of the laboratory that produced these peptides to see the purity of these peptides? Because if it's not pure, then obviously you're not getting the same effect, right? So, and it should be done by a third party. That's the key, because obviously if I'm making something in my laboratory, I'm not going to say it's a bad product. I myself would give it A1 with 99% purity. But however, if I hire a third party to come in and evaluate the product that I have, they have no say into this. They're third party and they're not related. So they gave their honest assessment of how good or bad the product is. So here is 99.9% pure. So the purity is high. So that's why when the patient come in, I was on semaglutide and XYZ clinic and I was at 2 milligrams. You need to start me at 2. Generally, we like to shy away from that because, again, at the end of the day, these are all medication. So I often say if one Tylenol make your headache go away, you don't need to take 5, right? So if I'm able to increase or deplete your glycogen, make your glycogen storage highest, and you're walking away from the sugar and you're losing weight with 0.5, there is no reason for me to put you on 1 milligram or 2 milligram. However, there are patients that they come in after putting in a 1 month, 2 months, 3 months, whatever. They're losing weight, but now they're sort of stable. And then at that scenario, we can go up to a higher dosage or even change the class of medication, go from semaglutide to tirzepatide to retatrutide, which I get into the following videos. But basically for this video is semaglutide, and we start at 0.25 and then we go to 0.5. And obviously you come in, we can weigh you every time, make sure everything's going everything's going down and going well. You don't even have to come in. We normally sometimes can do this over the phone if you're far away, and we have many patients that we actually ship the product to. So one of the other thing I want to get into, which is really critical, and there was a patient on a video testimonial. If you want to actually go to my YouTube channel, you can actually watch that video about a patient themselves that told me, hey, doc, I've been on different product before, I lose weight, but now I'm with your product, I'm actually losing more weight. And the other thing is my muscle is toning up more. And I said, can you please put that in a video for my patients? And she did it. And the key to this whole thing, there is another peptide. It's called PBS 157, right? BPC 157, right? So I include BPC 157, and again, you can look this up, BPC 157, go to Google and look it up, or go to ChatGPT, and it tells you all the good and bad about BPC 157. BPC 157 is another peptide that is for muscle recovery, for your gut health. So if your gut is healthier, then obviously you will lose more weight. That's the key element. So all my peptide shot, GLP-1, GLP-2, GLP-3, they include the peptide called BPC 157, and you absolutely don't pay extra to it. The reason I include this is because I don't want you to lose weight and also get flabby muscles. So the key is to lose weight and have the muscle tone that you deserve to have. So for example, I'm on retatrutide myself, and BPC 157, keep your muscle tone the way it's supposed to be. So when you're losing the weight, you're not actually getting flabby in your muscle. But that doesn't mean you should stop working out by any means. Doesn't mean, oh, okay, I can just inject BPC 157 and I'm going to build muscle. BPC 157, what it does is for your healthiness of your gut. And if you go to my website, I explain that thoroughly, youngerlook.com, and you can read up more about it. And again, you can ChatGPT this, and And that I doubt it if you find any article that speak against it. It is a good peptide to have. There are athletes in our clinic that they come in, particularly for that BPC 157. For example, if you have shoulder injury, we inject it right into the shoulder. It's good for muscle recovery. But in a sense of a weight loss, is for healthiness of your gut. They're all included in that shot that you take home, and hopefully that will increase your muscle tone as you're losing weight. In the next series of video, I'm going to talk about terzepatide and obviously retatrutide. So stay healthy, stay well.